Good afternoon, everybody. Today's EPN webinar is going to focus on stress management and self-care for home care clinicians during COVID-19. And we are thrilled to have Dr. Elizabeth Galik with us from the University of Maryland. She's a two-time webinar presenter, so she presented much earlier in the series on dementia management and did a phenomenal job. And so welcome, Dr. Galik.
Thanks,
I decided to surprise my colleague, Nassim Weisborg, who is secretly behind the scenes for every single webinar. So he's a little bit shy, but I wanted to give him the spotlight and say thank you, Nassim, for all of the amazing tech support you've been doing. He is a home care leader, is on the board of Minka, and thank you, Nassim. All right, moving on.
Truly a pleasure. Thanks for the shout out.
The voice from the background. And Nassim will be moderating the upcoming webinar on Friday, so you have to join us. But before we talk about Friday, let's thank our sponsors, the Office of Preparedness and Response of the Maryland Department of Health. Every time we thank you, we mean it from the bottom of our hearts because we've enjoyed this webinar series so much, and so many people have told us that they've gotten a lot out of the sessions. So thank you, OPR, thank you, EPN, for launching this, and Minka, the Maryland National Capital Home Care Association. Again, for those of you who in the audience who work at or own home care agencies, this is your chance to join Maryland and DC's premier association for home care agencies. Just contact Dawn Seek at dseek@minka.org. So what's coming next? On Friday, Dr. Luke Kalb, actually he's a PhD, I made a mistake there, is going to be sharing his research on mental distress among children during COVID. He has actually published some research on the issues that children are experiencing, and he has a lot of experience doing research with children who live with disabilities and who require care at home. And so don't miss out, because I think there are going to be a lot of tips in there that we can all apply to the children we have, whether or not they are receiving home care. So sign up now. All of the events can be found at mdemergencyprepnetwork.org, if we could get rid of the little talking there, /events. Then we have Minka's own Linda Teodosio is going to be speaking about post-COVID clinical considerations in the home. On December 15th, we have a repeat appearance by Dr. Abrams, who talked about social isolation very recently. He'll be talking about garnering community support for caring for older adults with COVID in the home. Alma is also making a repeat appearance. She is a certified nursing assistant and student leader. She will be talking about caring for the caregiver, but through the lens of her own work in home care as a certified nursing assistant. Finally, I had to put myself in the schedule. So for those of you who don't know, I'm actually have a 20-year public health career working on pandemics and viruses, and it is my turn to share intelligence with you about the pandemic and how it applies to home care. So stay tuned. We'll be loading up my webinar on the Emergency Prep Network site, and I hope you'll sign up once it's there. Dr. Galik, one of my favorites, she specializes in improving neuropsychiatric care practices for older adults and their caregivers. She is so talented. She is a PhD, she's a nurse practitioner. She has served on multiple, as a PI in multiple studies, and she is a dementia expert, has developed a house call practice for dementia symptom management. But what she noticed during her work in the pandemic, both in facilities and at home, is the amount of stress that all of the clinicians are under, like regardless of where you're working. But let's talk specifically about the kinds of stress that home care clinicians are experiencing. Dr. Galik is the one to share her insights with us, and we are very, very grateful that she's joined us today. And so at this point, I'm going to hand over to Dr. Galik, who will share her screen and take over mine.
Thank you, Charlene. Thanks so much. And thank you, Nassim. And now we're going to make sure I can do this well. I'm getting better. There we go. All righty. So today we're going to talk about taking a little bit better care of ourselves because, we've all been under a fair amount of stress caring for others, and often healthcare providers put themselves at the end of the list. And so this will hopefully serve as a little reminder and to take a little bit better care of yourself. We can't stop stress, but we can learn how to manage it a little bit better. And hopefully we'll have some little tidbits and some little pearls for you to take back with you for your own life, as well as for those that you work with. Also, you will see here, and Nasen will be putting it in the chat window, there is a link here. It's a very brief survey for a geriatric workforce enhancement project that I'm part of. And if you could take a few minutes, you can do it during the presentation just to complete it. It's not information kind of evaluating the presentation. Dr. Brown will send that to you later at the end of the webinar, but this is just information that kind of talks a little bit about you, what your job is, what area of the state you're in, those type of things. Okay, so the emotional toll that the COVID-19 pandemic has had on caregivers, both professional and family caregivers caring for loved ones, has been significant. I think probably the biggest thing that I've heard from individuals across the country is just this fear and anxiety about one's own health, but more importantly, the health of others. So there's a great fear of being exposed to COVID-19, getting sick, or even being asymptomatic, but taking this home to loved ones. And I'm sure we've all seen on the news how some people have set up different sections of their house to isolate from their family and haven't seen loved ones who are at greater risk for some time. Many of us have also had to deal with financial pressures, unanticipated. And for some of us, those who are in more of a kind of primary care environment, not having people come into the office has cut down on business. I know the patients that I see in assisted living facilities, many of them have not been doing as well, and there are not new people coming into community care centers, residential care centers to replace them. Or as home care providers, you may have had difficulty kind of gaining access to people's homes because family caregivers want to keep people away because of fear of the virus. Or even if you're busy and working a lot, it could be that another family member, a spouse or a partner or someone has lost their job. So all of these things bring a fair amount of added pressure to us. Also, there's been changes in routines for us, more social isolation. If we're not working, we tend to be kind of hunkered down at home. We've had to deal with changing recommendations about what to do to keep ourselves safe and the people we care for safe. And I think that we've also seen kind of an under recognition or perhaps an under appreciation of people working in home care settings in particular. I think those on the acute care front line have received a lot of press and a lot of thanks. And, those in long-term care and home care settings, I think have been not recognized as much. And that kind of adds to additional stress. And of course, there's uncertainty about the future. While we're hopeful in terms of the vaccines that appear to be coming, we don't know when we're going to be eligible and how we're going to tolerate the vaccines and all of those things. So as I mentioned before, stress in our lives is inevitable, but ongoing distress isn't. And so what I'm going to hope to do in the next half hour or so is really to do three things: to distinguish stress from serious psychiatric conditions, to discuss the risks and, believe it or not, benefits of stress. And then the last one is really to give you some practical tools to manage your stress better. And they kind of come under 3 umbrellas: action-oriented approaches, emotion-oriented approaches, and then acceptance approaches. So some common signs and symptoms of chronic stress that could potentially signal that you may be having a problem. Now, all these symptoms I'm going to describe, there have probably been days where, except for smoking, I may have done almost all of them on a day. What we're looking for is that if you're seeing these symptoms routinely and if they're ongoing. So things like anxiety, irritability, or a low mood, feeling tired or run down, come home from work and you feel like you have to just lay down on the bed or the sofa. When we're overreacting to kind of minor issues, having difficulty sleeping at night, falling asleep, and then in the morning having difficulty getting out of bed to begin the day. I know lots of people have had challenges in terms of concentrating and even, with remembering certain things. We may have postponed our own medical care and we may be experiencing new or worsening health conditions. And, in many instances, we use things like alcohol or smoking or food to kind of deal with our stress. And so we may be smoking, drinking, and eating more. And then, feeling angry and resentful. And so all of these things can happen. We're more concerned if this is happening chronically. So caregiver burnout is a state of emotional, mental, and physical exhaustion that is caused by prolonged and overwhelming stress that's specifically related to your caregiving role. And signs and symptoms of it, again, are neglecting your own needs. So I'm too busy, I don't have time to relax, I don't have time to sleep, I don't have time to exercise, or you really don't care whether or not you do these things. Physical exhaustion, feeling amped up all the time that you just can't relax. And then, one of the more troubling ones is when there's decreased satisfaction with that caregiving role. So many of us entered healthcare with the desire to help others, and that gave us a lot of pleasure and enjoyment and satisfaction in our roles. And when we start to not experience that anymore, that's kind of a big warning sign. And then also thinking about feelings of helplessness and hopelessness. Major depression, on the other hand, is a leading cause of disability. And sometimes caregiver burnout can lead to a major depression or an anxiety disorder. And as I mentioned before, caregivers may not fully recognize or admit to depressive symptoms. And some of that has to do with depression itself. So a lot of individuals who are depressed have what we call cognitive distortions, where you don't kind of see your symptoms as being as severe as they are. And so sometimes you need to take cues from others around you if they're telling you they're concerned or if they're noticing changes in your behavior, to really kind of listen to that. So the definition in terms of major depression is 5 or more symptoms in the past 2 weeks. And it's things like depressed mood, anhedonia, and you need to have one or either depressed mood or anhedonia, and then some additional symptoms as well. Sorry, I'm getting a phone call that won't stop. There we go. Other symptoms include things such as weight loss or weight gain, changes in sleep patterns, change in our psychomotor activity. Sometimes we're restless, having motor restlessness. Other times it tends to be more of a slowing down, what we call a psychomotor retardation. Fatigue, loss of energy, feelings of worthlessness or guilt. Again, challenges, concentrating, thinking, making decisions. And in some people, they're even thinking about death or suicide. And so you need to have these symptoms, 5 or more of them, for at least 2 weeks, and they need to be severe enough that they're causing distress or impairment in your day-to-day function. And they're not related to a secondary medical condition or a substance that you may be using. So anxiety disorders, there are many different categories of anxiety disorders, but they do share the following features. One is excessive fear. So it's this emotional response to real or perceived imminent threats, but the fear is excessive. And then you have this anxiety, this anticipation of a future threat. There often are related behavioral symptoms. So like I said before, irritability, motor restlessness, those type of things. And if you have an anxiety disorder, you may display some avoidance behaviors. So if going out is stressful, you may find that you're staying in the house more, different things like that. And the 2 most common anxiety disorders that impact particularly healthcare providers are generalized anxiety disorder and panic disorder. Generalized anxiety disorder, it is kind of classically what we think in terms of anxiety, and where you're feeling nervous, tense, maybe irritable, difficulty concentrating. And all of this tends to be exhausting for someone. And so often it's, even though you feel nervous and hyped up, later you're actually feeling tired. So fatigue is common. And you need to have a diagnosis of an anxiety disorder. These symptoms need to be present for 6 months or more. And that you have to have this sense that you can't control the anxiety. And typically there's more than one stressor occurring in everyone's life. And now everybody pretty much has COVID as a stressor, but often there's something else. Panic disorder includes having kind of these acute panic attacks. They're discrete episodes of intense anxiety, and they can last a few minutes and up to a half an hour. And the symptoms tend to be very physical, somatically focused. So people describe feeling like they're going to die or feeling detached from their surroundings. Their heart rate can increase. They often get short of breath. They may have chest pain, nausea or sweating or dizziness. In many instances, these symptoms can kind of mimic a heart attack, or, you know, you feel like you're not getting enough air before they pass. So those are the things to kind of look out for. And if you're having them, that's really when you need to contact your healthcare provider. I know some companies have an employee assistance program. That's also another place to look for help. And the Maryland Department of Health recently, their behavioral health unit has kind of compiled lists of behavioral health specialists that people can see in terms of counseling or you know, if medications are warranted. So there's lots of different ways into mental health care now. And additionally, nowadays, it may be even easier to access because many mental health providers or behavioral health providers are doing telehealth. And that really can be a perfect use of telehealth. So again, back to self-care, trying to prevent all that from happening. We need to take care of ourselves. It's not a luxury. It really is a necessity. And a lot of us have heard some of these things before in terms of if you're giving too much of yourself to everyone else, you're not really able to pour from an empty cup. So you have to really take care of yourself. And it's not selfish to take care of yourself. It's helping you, but it's also helping the people that you care for. So historically, way back, the stress response was something that happened because it was deemed protective. And it's a protective mechanism to help us survive and deal with extreme challenges. So if you can think of a time when you've been under stress, not chronic stress, but acute stress. The stress tends to energize your body and prepare you for action. It can help you to rise to the challenge ahead. And it does this by changing, how we respond physically. So our heart rate increases, our blood vessels constrict. Our memory during acute stress tends to be a little bit better, and our concentration can also be better. We may have increased energy. Actually, there's some ideas out there about people who procrastinate, that one of the reasons that procrastination occurs is when you're really up against a deadline, you get this acute stress response, and it does kind of help you concentrate and then get things done quickly, rather than kind of moving along and working gradually at a problem. And it does this by, our body deals with stress by releasing different stress hormones. So adrenaline is one of the stress hormones that causes the increased heart rate and the constriction of the blood vessels, norepinephrine, and then cortisol. And while these stress hormones are great for acute stress management, they're not so good for chronic stress management. We're going to talk about some of the impact that these stress hormones have on the body over time. So when we're under chronic stress, those same hormones can cause challenges in different body systems. So in terms of our brain and nervous system, we may be more hypersensitive to pain. We may have more headaches. We talked about some of the psychological impacts. Our skin, we're more prone to acne or rashes. Some people, when they get really nervous or anxious, break out into a rash. Our muscles and joints tend to become more tense, especially in our neck and shoulder region and in our back. And that's why at the end of the day, having somebody give us a massage, right here in our shoulder area and back often feels really good. We talked about the chronic, so the acute impact in terms of heart rate is increased heart rate, increased blood pressure. But when this goes on chronically, it's not good for our health and can actually put additional strain. You can have GI symptoms. Chronic stress increases the risk of diabetes and causes more problems with other systems, including the immune system, which we don't want to challenge right now, given COVID-19. So it's important to understand how all of us respond to stress, because it all looks a little different. And I want you to think right now about your own stress signals. So what are they? Maybe it's a headache. Maybe you notice yourself kind of clenching your fists. For me, I tend to tense my neck muscles and bring my shoulders up. Other people get stomach pains. Some people withdraw, negative thoughts. So whatever your stress signals are, kind of think about them. And so that when you begin to identify them and feel those things, you can implement some of the strategies we'll talk about in a little bit to help to deal with them. And also, particularly think about what the triggers are to your stress. Is it when there's danger to your loved ones, when you're feeling that people are putting you down, when you're expected to do too much? Think about really kind of what pushes those stress buttons for you, so that again, you can, if you're feeling that coming, you can employ those self-care strategies a little earlier. And then also think about what are your tactics, or what methods do you use to help calm yourself down? So these are your coping strategies. And, for many of us, they don't have to be healthy. It can be things like drinking too much, or eating too much, or not moving around, kind of isolating, or, not staying in touch with our friends. So think about what our coping strategies are, and what might be, if we have ones that might not be as healthy for us, how can we replace them with other things that would be? And then also try to identify who in your life really serves as your support system. and think about that widely and how you can kind of activate that support system now that you're under more stress. And so here's just some kind of funny pictures of some of the things we're going to talk about in terms of taking better care of ourselves. So stress, we can't eliminate it, but we can learn to deal with it. And the three different categories we're going to talk about are action-oriented approaches, emotion-oriented approaches, and then acceptance approaches. For action-oriented approaches, one of the best things you can do is try to be a clear and effective communicator and ask for help. We all have different ways of managing stress, and different things kind of push our buttons. And when a family member or a coworker might think they're being supportive of you, they may actually be doing something that's stress, that's causing you more stress. So we have to be clear about what we need. So these two things I'd like you to think about it is what I need from my friends and family and coworkers to do when I'm stressed is, and then you kind of fill in the blanks. What I need my friends, family, and coworkers not to do when I'm stressed is. So I'll give you an example for myself. When people just tell me, oh, well, you'll get through it, you'll be okay, you're a strong person, that really does not helpful for me in terms of stress management. I know many of us have had bad days before. We come home and we're kind of venting to a friend or a loved one, and oftentimes we just want to kind of let it out. We want to just say what's wrong. We don't need a whole lot of advice right now. So sometimes just listen, having people just listen to us is helpful. But often people feel like they need to fix the problem. And so it's okay to share with them, you know, when I come home and have a bad day, it's okay just to listen to me. And kind of empathize with the situation I'm under. You don't have to fix it for me. Sometimes just talking about it and processing it helps me, but we have to share that with people. We can't just assume that they know. Other action-oriented approaches are setting a daily routine. So trying, to get up at the same time every day. Not if we're working at home more often, not kind of spending all day in our pajamas. I know it's comfortable, but getting up and having some structure to the day. Reach out and, sometimes when we do good things for other people that may be not related to our work, but just good things in general for a friend, whether that's wishing somebody a happy birthday, telling them something good that's happened, or those type of things can really help to make us feel better. We talked about seeking support when needed, and then trying to have things to look forward to. So setting up either remote or physically distanced activities that we can look forward to. Now it's getting a little colder, it's a little harder to do things outside, but I know some friends from work, we're gonna do a massed walk on a very wide trail at one of the Patapsco parks coming up this weekend. So things like that you can do, whether it's virtual book clubs or virtual museum tours or recipe swaps, concerts, game nights. We're getting more and more creative of how to use technology to reach out. And we always have to think about managing your personal resources. So being kind to yourself, our resilience, and avoiding personal judgment. Oftentimes healthcare providers are terrible about this. We always think about the things that we could have done, or how could we have done better, or how could we have worked quicker or smarter. And we need to be a little patient with ourselves, and everything doesn't have to be perfect. We need to show some self-compassion. And when we get knocked down, we might need to stay down for a day or two, but after that, how are we going to use some of our inner resilience and get back up again? So now on to some emotion-oriented approaches to stress. And these are things like reading or engaging in daily affirmations, mindfulness or relaxation, positive imagery, or cognitive restructuring. My husband worked for a company, a healthcare company, and one of the things that I loved that they did was every day they sent out a affirmation or kind of a little quote of the day, and he knew that I always enjoyed the ones that the ones that I got the most pleasure with were often either Buddhist or from Native Americans, and he would forward those on to me. So if you have some great little quotes or uplifting affirmations, sharing that with other people can help them as well. We're going to talk a little bit more about mindfulness. So these are some resources that you can have. These are all free. So they're apps and websites that will walk you through meditation, mindfulness exercises, where you're trying to concentrate on the here and now and concentrate on your own body and breathing, and not trying not to let your mind wander onto all the other things that are taking up our emotional energy. And so there's several things that you can try and use. Here's some other examples of things people have worked on. Gratitude journals. I know I got a lot of pleasure. I read something in the New York Times over Thanksgiving holiday, and one of the things was people listed all the things they were grateful for, even during that time of COVID. And my favorite was, I've spent less money on lipstick, because people are, wearing masks. Some of them were funny, some of them were serious, but thinking about that, maybe even developing a network of coworkers or friends so that you can share some of the things that you're grateful for, not only with yourself, but with other people. And this is just a simple example of practicing mindfulness. And this can kind of be done anywhere. I know sometimes when I have a stressful patient encounter or something, once I'm done with the situation, I'm going back to my car, and I may stay there. I may get in the car, drive a little bit, and go and just try to take a few minutes to, take a break, relax, try some deep breathing, and try not to let my mind wander before I go on to the next patient. And then lastly, we're going to talk about acceptance approaches. And these often are things that we really rely upon when we have situations that we can't control, like the pandemic. So it's, kind of trying to establish a routine of healthy behaviors with things like exercise, eating healthy foods, making sure we're trying to get enough sleep, and then engaging in a contact with others and social support. And, us as individuals, if we are taking care of ourselves, it's not only going to do good things for our health, but also will serve as good role models for other people who may be stressed as well, some of our clients. Here's some photos of people engaging in exercise. Some of these are from a work health promotion program in a long-term care facility for staff. So this is just, I included this as kind of a fun little slide. I did this at the last minute, but I had a challenging clinical day and was feeling kind of sad. A lot of my patients that I care for hadn't been doing very well. And fortunately, right before Thanksgiving, a group of staff that I had worked with, and actually it was probably about 4 years ago, sent me pictures and stories about how they engaged in a turkey trot in a small assisted living facility. And it got people moving, it got staff engaged, and everybody was saying how, while it seemed kind of silly at the beginning, everybody really felt better at the end. And we're laughing and smiling, and it kind of gave something for them to feel excited about. And, life was still going on even though COVID was there. So I just want to bring that up, that sometimes, sharing these little things with other people can make such a difference, and having them come back to us really can kind of boost things. And that's engaging in exercise as well as social support. These are several links that will send you to free exercise resources. And you don't need any special equipment to engage in any of these things. If you don't have, some of them involve weights. If you don't have weights, water bottles work great. Canned peas or whatever also works great, that you can use as weights for some of the resistance exercises. Some are designed for those of us who might be older. Others are, kind of more rigorous. But again, these are all things that can be done in your home. Healthy eating is also, important. And I know, especially for people who are quite busy, it's challenging. You're working and then running into the store to try to grab something, and preparing healthy foods can be challenging. I've been trying to use, I was sharing with Dr. Brown and Nasen earlier that a group of nursing assistants that I used to work with probably about 15 years ago, we've been sharing recipes that are quick. Many of them can be in the crock pot on Facebook, and that's been a lot of fun. Just getting to try the recipes. They tend to be fast, and they're not that difficult to do. And then being able to share online, how we've enjoyed them has been something that's been pleasurable. Also, we have to take into mind sleep. So making sure that we have enough time for sleep, that we're setting up our room so that we're getting rest, that it's dark, that it's noise free. A lot of us have a bad habit of taking our phones into bed or watching television, and we know that the blue light from that emits from those screens actually stimulates us to stay awake. So if you can give that a break a half an hour before bed, it'll make it easier to go to sleep. Also trying to moderate caffeine, tobacco, and alcohol use, and keeping that away from bedtime, and avoiding big meals before bed. And so we're trying to change some of our habits that might not be the healthiest into ones that are better for us. This is just an example about considering mind, body, and spirit, and someone's self-care plan that they've developed for themselves, and also putting things, what their goals are in terms of what you want to accomplish, as well as considering who you have as your support network. And sometimes writing it down and seeing it can kind of help to remind you. We're really good as healthcare professionals of developing care plans for other people to do well and to be healthy. And again, we have to take care of ourselves as well. So that self-care plan might be something you might want to try. And then building resilience. So how we think about stress matters and can influence how our body responds to it. If we think of stress as a challenge that we can eventually, that we can deal with, reframing it that way rather than feeling powerless can help people to keep going. It helps the body to be energized and prepare for action. And I want you to try to think about, in the past month, how much stress you've experienced. Probably all of us have experienced more than we have in previous years. And then again, try to do something for yourself that's personally meaningful, whether that's taking a walk, reaching out to an old friend, listening to some wonderful music, exercising, setting up your room to be as comfortable as you can for a good night's sleep. All of these things can help to bolster resilience. So I'm going to challenge all of you to pick one action that you'd like to change, and set a goal, and give yourself a deadline of when you want to try to do it, and think about who are going to be your resource people to help you. The buddy system often works great. So it helps to give you some accountability. And then I'm just going to end up, these are some online resources that are fairly comprehensive in terms of stress management. One was put together by Leading Age, which is an organization that deals with senior living, whether that's through home care or long-term care. And they have a whole chapter on wellness, physical and psychological health, not just for older adults, but also for staff. The Doctors Without Borders developed a toolkit. They've done, actually, this is kind of an interesting story. The organization for the first time came to the United States and worked in both Michigan and the Detroit area, as well as Texas, because to try to help with the pandemic, and saw that the healthcare providers, particularly those in long-term care, foster care, and home care, needed a lot of resources in terms of wellness and mental health, in addition to education about infection control, et cetera. And so they've provided some great resources that can be helpful, not just to individuals, but to managers as well, in terms of how to support your staff. And then the last one is the Maryland Department of Health's behavioral health webinars for healthcare workers during COVID-19. There's a whole laundry list of webinars that are coming up that, again, focus on improving behavioral health. And so I wanted to share that with you as well. And so now I'm happy to take any questions that you might have.
Thank you so much, Dr. Galik.
Sure.
That was a phenomenal presentation. Why don't you stop sharing your screen so we can see your beautiful face? There you are. Okay, this is the time we've all been waiting for. But before that, whoever wants to create a little mini accountability session right now during this webinar, if you want to set a goal for healthier lifestyle during the pandemic, throw it in the chat and we're going to cheer you on. My goal is to not go to bed every single night with this device every night. So thank you, Dr. Galik, for reminding me of what I know but don't execute. Yeah. And that is I hereby announce that as my goal. And others, this is your chance. Share public accountability. Also, because so many of you were able to join the webinar after the initial beginning, I wanted to give Dr. Galik another chance to talk about the Qualtrics survey. Do you want to just jump in again and announce that?
Sure. So there's a quick Qualtrics survey. It's a link. Nasin put it in the chat box, and I'm part of a geriatric workforce enhancement program, and our goal is to try to reach out to as many people in healthcare that work with older adults as possible. And so this is just gives me a kind of account of how many people that I've interacted with in the virtual world. It's easier to do it when we're working face-to-face, but there's not as much of that anymore. And it shouldn't take you long to fill out. If there's anything you don't want to fill out, just don't, and skip it, or just say, other or whatever. But it's mostly things about what you're doing professionally.
Wonderful. So that is in the chat. And I invite you now to share your questions, comments, and feedback for Dr. Galik in the Q&A section of your Zoom screen. And we're going to go to our first question, which is actually a tough one.
Yeah.
So,
I see it.
I'll read it out loud for everybody else.
Okay.
Is the Department of Health offering free behavioral services for those currently without insurance and presenting with symptoms of depression and hopelessness during this time? Dr. Galik?
So to be honest with you, I'm not 100% certain. So I don't want to say, yes, definitely it is. I know that there is that service for individuals working in long-term care, and it is free. I don't know how far it extends into home care, but it would be worth looking into. What I will do after this is over is I will do a little more research on that, and I'll at least send the link about the services that are provided to long-term care, because it has to be something that you're employer kind of registers for and says, I want my employees to be engaged in this. And I have a hunch that it's not just for long-term care, that it may be more inclusive. So I'll look a little bit more into that. But I do know that service is free. It's not designed to be long-term, but short-term, and kind of get you hooked up to other resources that may be out there. And there are some with the Maryland Department of Health Behavioral Health Division, there are some providers that they have listed, some that take insurance, some that do sliding scale type things. So I'll pull some of that together again and send it out. But also, consider with your employer, if there are many employers now have employee assistance programs as a benefit, and thinking about that, going to HR, if you have an HR resource person, often they can be helpful as well.
That's great advice, especially the part about the employee assistance program. If Dr. Galik finds any additional resources, we can, and shares them with us, we can share them with the EPN network, which you belong to now because you registered for this webinar. Wonderful. Okay, let's see if there's another, I think there is another question. My name is Aminata. Thank you, Dr. Brown and Dr. Galik. Great presentation, very informative. I agree. My goal is to be able to convince my husband that the TV should be off while we sleep. I'm sorry. I have the same problem, so just for some commiseration there.
Some ideas about that, because some people do like the background noise and find that helps them to sleep and use the TV for that purpose. But you can, so you might want to substitute it with music rather than the screen, which because of the light will keep you up. And they also make
white
noise machines. And then my daughter, for younger folks, they have celebrities who tell stories or things, like really boring ones that help you go to sleep. And she said her favorite one is Harry Styles, who will tell you a boring story, and she said it always works for her when she can't sleep.
That's hysterical.
And it's like a app. I'll ask her for the link, and they keep adding celebrities who do this, so it's kind of entertaining as well.
Wow. There you have it. Options, Aminata. You have options. In terms of getting back to the survey screen, it's in the chat. And so I can copy paste it into, well, it's the chat. So if you look at the bottom of your screen, you'll see chat. And if you scroll up, you'll see Nossen Weisborg has shared the survey.
While we wait for some other questions, I want to give you one other tip and things to think about is we've all had times in our lives where we've been faced with challenges. And some of those challenges, we probably thought we would, at the time, we thought, I don't know if I'm going to be able to get through this. It could be the death of a loved one. It could be a natural disaster. It could be, a personal illness, whatever it was. And think back to what kept you going during those times, what helped, what made you kind of more resilient, because oftentimes they can help now. You might need to change and adapt them as the stressor is different, but often those will give you good clues about how you can bolster yourself.
That's fantastic. So we have one question and a bunch of really interesting comments from the group. So let's go through those first. We have Cicely is seeking accountability to spend at least 1 hour a week with friends on Zoom, just chatting and de-stressing. That sounds phenomenal. We have some props for you, Dr. Galik. Thank you for such a very enriching talk. Deborah Jackson wants to take a moment each day to appreciate myself and remind myself I matter, you do matter, as you do for others. Here's the secret, Dr. Galik, the Calm app.
The Calm app, that's what it is.
Thank you, Jessica. And Cicely also says thank you for the presentation. So let's move over to the question. We have a couple of questions. Okay, the first one is, please share Dr. Galik's email again. Do you want us to refer people to the slide presentation?
That, or you can just type it in. I can type it in the chat. I'll type it in the chat. It won't take me but a second. I type it so much that I can type and talk.
Sounds great.
There you go.
All right, we have one more. Sharing affirmations and positive thoughts to staff on a daily basis via email is a great idea. Oh, that is a great idea. Do you have suggestions on apps or websites where I could get those, Dr. Galik?
You know, I don't, but I could find out for you, because it's usually not that hard. And sometimes, like, be creative and don't just go to when my husband's company did this, you know, he's not with them anymore, but when they did this, one of the things I loved about it is they went to all different places to find them, so that there would be something that spoke to people, you know, kind of over time. So you can even find great quotes from people from history, people you don't know. If there's something that speaks to you, I have like it's like a little quote file that I keep of like inspiring things that help me to keep going. Some of my favorite are from Eleanor Roosevelt.
That's wonderful.
Yeah.
I'm typing in just a message for Deborah that we can announce to everyone. For those of you who have tried to get to Dr. Galik's survey, there is one question on the first page, but there is an arrow on the bottom right hand of the screen that if you click it, it'll bring you to the next page. So if you answer the first question, it's not a one question survey, you answer that question, then you click the arrow
the next
on the
page,
screen, it will keep bringing you to the next page. Okay, wonderful. So let's go, questions, let's see. Okay, so we did that one, and yes, thank you. You're welcome, Cleopatra. But I think Dr. Galik, I'm just happy that she came and shared all of this great information. It is 12:53. Okay, we have a couple. There are a lot of questions about the survey. So Nasan, if you could just throw that link into the chat again. So it's more, there you go.
And another thing for those of you who may be managers, people, while we all like a pizza party or whatever, you know, a global acknowledgement, the one thing that shows up in the literature time and time again, that the best way to engage with staff and during difficult times is to give them a specific compliment. So not just, you're doing a great job, but you know what? You went out the day after Thanksgiving to see this new client, Mrs. Whatever it was, and she called me and told me how grateful she was. So when you're giving positive feedback, try to be specific about something that person did great, because those are the things, those are the kind of those little warm fuzzies that we get that keep us going.
You might regret that you said that, because I think we should do an exercise of putting in the chat a specific thing you are thankful to Dr. Galik for sharing in her presentation. Because I think that is a really great way to share feedback and keep it specific. And so I really appreciate you talking about the kind of stresses that home care clinicians have, and just sort of the broader stresses of working during the COVID pandemic. It has been a treat. I'm going to check out the Calm app. I think a couple other people are going to as well. So you can thank your daughter for that.
I know, because I was like, what are you listening to? She's like, Harry Styles putting me to sleep. I was like, okay.
It's such a strange thing for a celebrity to, I would have felt that question.
It gave them a thing. Apparently, younger people will know about this better than me, but it sounds like a lot of the people who are in performing arts have been really decimated by not being able to do live
Oh.
performances and things. And so there's a lot of really creative things that people have done online related to this.
Maybe we should have gotten some celebrities to come and talk about home care and the.
I know. But you know what? One of the things they've done, and it wasn't all they had celebrities playing the parts of healthcare workers.
Whoa. Oh, interesting. Yeah.
And so they were interviews that were conducted with healthcare workers about what it was like to work in the pandemic. And it was all in acute care, but it was still quite powerful because they had these famous people playing nurses and nursing assistants and healthcare technicians and talking about, what it was like working in the pandemic. And it was the American Nurses Association, I think, might have put it up there. I'm not sure.
Okay, well, that's wonderful.
Yeah.
Yeah, I think I want to start now talking about pop culture and TV, but instead of doing that, I'm going to turn back to the to the audience and see if there are any final questions before we close out this phenomenal webinar that Dr. Galik has provided us with. So we're going to be comfortable with silence for about 30 seconds. This is your moment. I wish I could have like a little clock.
We can be mindful.
Yes. All right. If not, then I'm going to do my final thank yous to the wonderful people that have made this webinar possible. So for those of you that didn't catch it in the beginning, we're going to thank the Emergency Preparedness Network, the Maryland National Capital Home Care Association, my company, Learn Care Together, and thank you for attending. We're going to close out right now. Thank you, thank you, thank you. Have a wonderful rest of your day and stay safe.
Bye-bye.